Hello and welcome everyone. It's great to see that so many of you joined us today. So I'm happy to see some familiar names and some less familiar. I think we have some applicants and offer holders who joined us today, but also some people who have showed some interest in our postgraduate certificate in skin aging and aesthetic medicine course. So it's really nice to see a mix of applicants and interest here. So my name is Xavier. I'm the course advisor for the online skin aging and aesthetic medicine PGCert course. I'm here to make your decision about studying at the University of Manchester as straightforward as possible. And I'm here also to guide you through the application process and answer any questions you might have. So please feel free to contact me after this webinar, especially if you're watching the recording. I know that some individuals expressed interest in joining us today, but were unable to do so. So you can see my email address at the bottom of the screen here. It's studyonline@manchester.ac.uk. So you can contact me anytime and we can arrange a one-to-one consultation on Zoom or over the phone to discuss the course further if you have any questions. So don't hesitate to just direct email me and I'll be happy to help. So our topic for today's webinar is become a trusted expert with an online PGCert in skin aging and aesthetic medicine. So if you are considering studying with us, this is an excellent opportunity to learn more about the course and have any questions answered before you submit your application. Feel free to use the Q&A function or the chat box and interact with us. We're here to help you. So I'm very pleased to say that we are joined today by Dr. Helen Graham, our academic director. Helen has a wealth of experience in the skin aging field, and I'm delighted to pass over to her so she can introduce herself and give you more background on her career and academic interests. Helen?
Thank you. That's a nice introduction. Thank you very much. I'm Dr. Helen Graham. I'm an academic course director for skin aging and aesthetic medicine suite of programmes, and the one we're talking about today is the PGCert. I'm a senior lecturer at the University of Manchester, and my background is in research into the extracellular matrix. So I started my career looking at the development and deposition of collagen elastic tissues in the embryo, and then that took me through to aging, and I was looking at aging in the heart and contractile dysfunction at the onset of heart failure. And then this aging process took me into the skin, and now I'm interested in how age-related changes impact on the skin mechanical properties. So my membership of British Society of Matrix Biology and Physiological Societies enable me to keep up to date with the new and developing areas. And I'm really excited about one of our first units is looking at the physiology and development of aging and how those particular elements affect our mechanical functions of the skin, because these are the key targets that we are then treating with iron therapies. Okay, so I'll pass you back to Xavier.
Yes, so thank you, Helen. So let's have a quick look at the agenda for this webinar. So today, Helen is going to speak about what you can expect from our PGCert in skin aging and aesthetic medicine. We will then share some testimonials, some words from recently graduated students. And to end the session, we will open things up to a question and answer. So once again, I encourage you all to ask any questions about the webinar topic and the skin aging course. Any question is valuable to anyone, so don't be afraid. So as I said, you can use the Q&A function and the chat box to ask your questions during the webinar, and we'll come back to them at the end. So without further ado, I will pass over back to Helen for the presentation.
Thank you very much. Okay, so welcome to this webinar. I'm delighted to be able to talk about this programme. We are presenting to you the Skin Aging and Aesthetic Medicine programme at the University of Manchester, the PGCert. So this programme has been developed to address this huge demand for training in aesthetic medicine. As you know, the non-surgical cosmetic market in the UK is around £3 billion alone. And the global market is expected to reach around 24 billion by 2026. So it's a massively growing area. However, there are some huge limitations still in this sector, and practitioners are having to navigate around quite a few of these. So we know that it's unregulated. In the UK, practitioners are practicing without accredited training, and there's no system for reporting adverse events. This is changing. The government of the UK have announced new licensing proposals, which will be brought in. We don't know the date yet, but it's likely that it will be based around training and premises. So this programme has been set up to align with the what was then a health education and training framework. So we're confident that we are covering all the areas required. So this programme has been set up, and the timeline for developing this programme was initiated from the KEO review, which was a government review which set out to look at the aesthetic and cosmetic industry. And the findings of this review were really quite damning, and reported that they were surprised to discover that non-surgical interventions, which can have major and irreversible adverse impacts on health and well-being, are almost entirely unregulated. And so the finding of the review was that dermatologists in particular are a crisis waiting to happen. And we have started to see this happening, that many adverse events are occurring, and the recipients of those treatments are have very little redress. So the recommendations of the review were to develop requirements for training, to establish a curriculum, and to register practitioners on non-cosmetic practitioners of non-surgical cosmetic interventions. So we've started along that path now. We now have the JCCP, which is the Joint Councils for Cosmetic Practitioners in the UK, and they've formed a register. We can also you can also look to see for the education providers who provide the training in that sector. So our skin ageing aesthetic medicine aims of the programme are to provide the knowledge base for clinically qualified graduates to practice safe, evidence-based aesthetic medicine and ultimately improve patient safety and care. And it's this patient safety and care that we are particularly focused on, to ensure that we've always got their best interests around all the decision making that occurs with this process. So the team, we've got a diverse faculty in terms of experience and discipline. So first of all, I'd like to highlight Dr. Tamara Griffith, who's the consultant dermatologist and medical director of the Skin Age and Aesthetic Medicine programme. And Dr. Griffith has been instrumental in the movement towards this legislation being brought forward. So she's one of the founding members of the British Cosmetic Dermatology Group. She also is a member of the CPSA, and is has been heavily involved in setting up the health education and training framework. So Dr. Griffiths has a deep understanding of this aesthetic sector, as well as the strategies that we are employing to try and move it forward and improve the sector. So we also have our unit leads here. Professor Nick Lowe is a consultant dermatologist and lead for injectables, and was one of the first, in collaboration with Dr. Jean Carruthers, was one of the first pioneers for the use of botulinum toxin on crow's feet for using for fine lines and wrinkles. We have Dr. Vishal Madan, who's a consultant dermatologist and nose surgeon, and is unit lead for lasers, along with Dr. Elizabeth Kramer-Brown, who's a labour education advisor. Dr. Abigail Langton is a lecturer in ethnic skin, and is unit lead for fundamentals of skin ageing. So Dr. Langton's research is in collaboration with Virtual Green Alliance, where they've worked on developing skin rejuvenation topical treatments. And we also have a number of tutors, Dr. Hamish and Darren's consultant dermatologist, Steph Ogden, Tommy Stagnell, Val Shergill, and Dr. Sam Holden, Natasha Berridge. So we've got a wide range of tutorial support and clinical and academic support. Okay. So if we run through the structure of the programme, This postgraduate certificate is online and it's part-time. So all of the learning content will be delivered to you online in the form of lectures or reading material or discussion forums, tutorials. It's designed to fit around your working schedule, so you can choose when you want to when you want to study, when you want to watch the lectures, but it's structured in a way that we cover the 4 units sequentially. So the first unit is fundamentals of skin aging. This is a prerequisite, so we ask you to do this unit first. And this really covers the structure of young, healthy skin and what the components are, the different layers of the skin, how they interact to make a strong and resilient barrier. We also then look at how this tissue age, what the insults are that trigger the aging process, and what the process of degradation of some of the components of the skin are, such as collagen and elastin, and how they change with age. So this really provides you then with an understanding of the targets that you will be identifying with your skin rejuvenation treatments. Okay, so this first unit starts in September 2023. The second unit is skin rejuvenation. This is looking at some topical treatments and minimally invasive treatments. And we look at the mechanism of action of these treatments and the safety and efficacy of each of those. So looking at how the topical treatments work, maybe microneedling, chemical peels and so on. So giving you an understanding of how the mechanism of action of those particular treatment types. Unit 3 covers the injectables. And in this unit, we ask you to look in a little bit more depth at not only the aging process of the skin, but also of the aging face per se. So thinking about how the different layers of the face change with age, so fat pads, muscle, bone, as well as the skin. So in the injectables unit, you will cover some anatomy, but you will also start to understand where the danger zones are for dermal fillers, and what the adverse events might be, as well as going through the process of consulting with the patient, understanding their particular needs for what they're presenting with, what their concerns are, and then how that can be treated with dermal fillers and botulinum toxin, but also making sure that the safety of the patient is always first and foremost. Okay, so that's the injectables unit, and then finally the lasers unit looks at the fundamentals of lasers and how those different the fundamentals of lasers, first of all, and light tissue-based interactions, and which wavelengths are particularly targeting which chromophores. Once you understand that, you'll then go on to understand what the different laser types are used for. So look at epilation, tattoo removal, vascular lasers, and so on. Okay, so that's the 4 units in a nutshell. We need to divide each of these units into a delivery over 10 weeks. So the first unit will take you 10 weeks. Second unit, then you'll have a week break, and then you'll have the second 10 weeks. So the recommended study time for each unit is around 15 hours per week across those 10 weeks. So this equates to 150 hours per unit in total. And then that's 600 hours for all 4 units, which you can take over a 12-month period. You'll have access to the full online programme whenever you start the unit. And these will contain video lectures, recommended reading, but also some discussion forums and some quizzes and activities. Okay, so within each of the units, you'll be directed to the different resources that might be relevant to that particular topic. Okay, so you might see these particular signposts which ask you to think about or reflect on that concept that's just been introduced. There might be discussion forums. There'll be recommended reading, which really is your basis for the supporting your understanding of that particular topic. There's tests and online quizzes, so formative ways of testing your own knowledge, and these can be done repeatedly over and over again, so that you can just keep going back to work out where your gaps in knowledge are. We have online journal clubs and recommended reading. Okay, at the end of each unit, We'll have summative assessments, so we'll ask you to complete a task and then submit it online. This might be in the form of a presentation or over video. It might be a group work. You might be making a patient information, but there's lots of different assessment. Okay, so there's no final exam. The assessments are, as I've said, have a multitude of types. So you might have a video elevator pitch presentation. We do have some peer review reports. There's a video mock consultation process. We ask you to critique some papers, and there's some MCQ short answer questions. All of these are submitted online, so there's no final exam or on-campus exam. Okay, so the entry requirements for this programme require either a medical degree or an overseas equivalent, so from an institution that's recognised and approved by UK GMC or GDC. You can have a dental degree, again, similar, overseas equivalent recognised by GDC or international equivalent. And we also invite nurse prescribers, so those nurses that have successfully completed the independent nurse prescribing course will be 300 course and are registered as an independent prescriber with the MMC. Okay, so just to give you a word from our students, this will be the third intake that we've had for this programme. We've had, we still keep in touch with some of our alumni. This is a word from Andrea, who's a dentist in the UK, and she was saying that she was practicing general dentistry within the NHS, and she really wanted to focus on aesthetic treatments, and so she took on this course to enhance her knowledge to help her develop her career more into the aesthetic sector. So Andrea is continuing to engage with us and to help discuss with new applicants if they're interested in the programme. She provides some help and feedback about the course. And Ashwin, also a dentist, has given us some great feedback about the course. He loved the online learning style and as it could fit around his clinics. He was nervous first of all starting with the system, but once you've learned the platform and the course content, he found very straightforward to use and thought the level was outstanding. So he would particularly recommend this programme. Okay, and one of our dermatologists, where Dad has decided to go into aesthetic practice, but the aesthetics discipline isn't represented in the dermatology trainees programme. So this was the ideal way for her to understand more about aesthetics before starting to practice. And she particularly liked the combination of research and clinical expertise at the University of Manchester, which brings together our dermatology research as well as our clinical research. So she really liked the idea that she could learn from interdisciplinary faculty of dermatologists, dentists and psychologists. Okay. So I'll pass you back to Xavier. I'm happy to ask any questions that you might have.
Yes, well, thank you, Helen, for this very clear presentation and for giving us more information about the students' experiences. So it is now time for the Q&A session. So please use the Q&A function or the chat box to ask any questions you might have. Don't be shy. And we'll start with the first question here is someone asking, how long do they have to complete the online PGCert, and is it possible to pause the study if
yes.
if needed?
So if you took all 4 units back to back, there'd be 10 weeks per unit, and you could fit that into 12 months. So it would run from beginning of September until the end of August the following year. If you wish, you can pause. So you could take the first unit and then you could pause and then take the next unit the following year. We only run the units once a year, so you'd have to wait until it ran the following year, but you can definitely pause. And I think you can have up to 24 months to complete the PGCert.
Good. I've got another question here. Is there any opportunities for research?
So once you've started, once you've taken part in the PGCert program, you will be in tutorials with some of the dermatology researchers. So if you were interested in doing research, it's something you could discuss with the program, some of the program tutors. There's obviously the master's program does an integrated research project, but this PGCert, there's no research project at that level, but it is something you could discuss with the tutors about doing some research.
Okay. I've got a question also. Say, how are students able to learn from other students with different professional backgrounds?
That's a really good question, because it's actually something that, from our feedback, was an unexpected benefit from the programme that the alumni have said. So by being on the course, we have discussion groups and forums where students work together in a group to complete a task. And in this way enables them to communicate with other students and interact. And then you can continue often WhatsApp groups set up to communicate amongst the group, and those are maintained afterwards. And it's sort of a benefit because it forms a bit of a network for second opinions and support after graduation as well. So you start by communicating on the online platform here, and then if you choose to, you can continue to communicate amongst yourselves. So it kind of is a good introduction to the other people on the course.
Great, thank you. I've got another question as well. Is there anything that is done in person, group meeting, practicals, opportunities to visit a clinic?
So this program is fully online, but what we do is make sure we have a drop-in session every Friday when the units are running, and that happens at 12:30 every Friday lunchtime. So you can chat to me or the other colleagues on your course. There's also, we run tutorials. These can be evenings or lunchtimes, and we invite our guest tutors in, and they'll run a tutorial then. And we also have a Q&A session at the end, so you can talk with us or to your colleagues at that time. But we don't have a practical element on this program. This is knowledge, but this is just your knowledge base. And in fact, our external examiner, who's a plastic surgeon, identified that continuing with or practicing aesthetic practice, 95% is the theory, and it's the understanding and the knowledge of how to practice safely and confidently with the patient's best interest. Once you've got that knowledge, you've got the confidence to then go ahead and complete the last 5%, which is the practical. So this is providing you with that knowledge base to be able to understand what to look out for, what the adverse events are, how to mitigate for that, how to critique the evidence and make sure that you are using evidence-based practice, and then you can go out and complete your practicals.
I've got one question as well. Is there any group work?
Yeah, so we two of the units have a group work-based activity, and we ask you all through the units. You'll see like small discussion forums that are set up to maybe discuss an issue or a paper, or critique a paper. But there's a couple of assessments where we ask you to work as a group. And then you each add your own perspective or your own particular critique for a paper, and then you put that all together as a final document. So there is some group-based activity as well included in the course. Yeah.
Great, thank you. I've got two questions which are kind of similar. So I will take one. Is that if I finish the diploma, can I follow it up with master in the same degree?
So currently, if you start with this PGCert, there isn't a pathway onto the masters, but we are working on making that pathway happen over the next 12 months. If you did want to do the MSc, you would need to apply to the MSc. Okay, so if you apply to the MSc, you can start and complete the PG dip, the diploma after 2 years, and if you want to choose to go on to the MSc, you can do that. But this PG cert that's fully online is a standalone qualification. Currently, there's no pathway onto our MSc, but we are looking to make that pathway and to initiate that pathway in the next 12 months.
I've got another question from an attendee. How many people are there in a year group?
It depends. It varies hugely year on year. For this particular program, it's around 10. It's quite a nice little group, but it has varied quite a lot. So it's difficult to say each year. It depends on COVID and all sorts of factors, to be honest. Particularly working in a clinical environment, what the level of pressures are. Yeah, it sort of ranges between 10 and 30, something like that.
Great. I've got another question as well. Can we expect a change in the regulations in the near future in the UK, and is the course taking that into account?
Yes, so that's a really good question. So the government has issued a statement to say that licensing will be brought in. We don't know when that will be, but we know that it will be requiring training and premises. It will be based around those two factors. So this program has been set up to align with the current training framework standards that were set up following the PO review. So Dr. Tamara Griffiths was instrumental in setting those up. So we aligned it with that. We're also in the process of registering as an education provider for the JCCP. So all of these are being put into place so that we're in the best position for when that licensing comes out.
Great. And I've got another question, which is that is the MSc degrees online as well? Is there any opportunities for hands-on practice?
Yeah,
there?
so the MSc has a practical element. So there's in the MSc, you take it over 3 years. Most of the content is online, but then you come onto campus for 4 days in year 1 and 3 days in year 2, and we do hands-on injectables and skin rejuvenation treatments. We do some work in the lab. We have lasers hands-on with volunteers. All of this is with model volunteers, and we also have a daily dissection session as well for the masters. So there's 2 on-campus teaching sessions for the master's program, but that's part-time as well. So again, you still manage to do your study around clinical schedules, but you just have to factor in those 2 on-campus sessions in January and November.
Okay. Another question is, what kind of support can I expect from the academic team during the studies?
Oh, so across the program, you'll be there's a study advisor once you start the program, and that's for your sort of operational questions. So how do I submit my assignment, or where do I find this particular topic on Blackboard, which is the e-learning platform. So you can contact your study advisor on a day-to-day basis. If you have an academic specific question, then again, you can put that to the study advisor and they'll field it out to the unit lead or the tutor that ran the tutorial for that particular session. And then we also have, as I said, the drop-in sessions on a Friday where you can talk to me if you've got any queries, or you just want to chat with other people on your program. And then we have the clinical and academic tutorials when we in each unit. So there's usually 2 or 3 topic-specific tutorials within each unit that are live. We ask you to attend, but if you can't, then you can watch it on playback.
Great. I think that's all for the moment. And well, thank you all for asking us those interesting questions. I invite you all. So if you have any further questions, don't hesitate to contact us and to contact me at studyonline@manchester.ac.uk. If you would like to arrange a consultation. So I'm just launching a quick poll here. If you would like to arrange a consultation, do not hesitate to select yes, and I will send a note to you, and we can arrange a Zoom or phone consultation. So applications are now open for the next intake, so feel free to get in touch about how to apply. Feel free to apply from now on. So as I said, you can email me at studyonline@manchester.ac.uk. So we will finish here for today. Thank you all, and we hope to see you starting the course soon then. Bye.